FDA advisors are voting right now on COVID-19 vaccine recommendations for the fall. They're deciding whether or not booster shots this year should target a single strain of the virus, and if so, which strain. That's a departure from the bivalent vaccines that are currently available. Let's talk about that and talk about so many more things. Dr. Kristen Moffatt, infectious disease specialist at Boston Children's Hospital. I have to be honest with you, Doctor. I thought we were done with these COVID questions, but we're not.
We're going to live with COVID, I guess, right?
Right.
All right, Dr. Moffatt, here we go. As you know, health experts have been discussing a new booster for many months now. So what do you think, look into your crystal ball, parents and school and looking toward the fall, what is likely to happen this fall?
Yeah, I think it's really hard to say for sure. I think it will be really interesting to hear the outcome of these meetings today. Some likely outcomes from today's meetings will include an across-the-board recommendation that future iterations of a COVID vaccine no longer include the spike protein from the ancestral strain or the Wuhan strain. We don't see infections with that strain anymore. We haven't since the beginning of the pandemic. And likely there will be a recommendation that this would be a monovalent strain moving forward that likely, for this year at least, would target the Omicron sublineage called XBB, because those sublineages are currently the ones that are really predominating both globally and in the US. So beyond that, it's a little bit hard to say what things will look like in terms of vaccine recommendations, but those are pretty likely.
Massachusetts, right here, we have one of the highest vaccination rates in the country. Just about everybody's received their shots. Most of us have been infected. A lot of us have been boosted at least once. Isn't that enough immunity for most people, Doctor?
Yeah, it's a great question. Again, it's just really hard to say because the virus, we know, changes over time, and we know that immunity wanes over time. So if, for example, the virus was changing but was not changing to be a virus that caused more severe disease, then yes, it might be reasonable to say that we have enough population level immunity from prior vaccines and infections to prevent severe infection in most people. But there's two problems with that scenario. One is that we don't typically know if the virus is changing in a way that causes more severe disease until it would be too late to start a whole new vaccine campaign. You would have wanted to have many people vaccinated already. And secondly, there are a lot of individuals who are still at risk from severe infection, including those with compromised immune systems or the elderly, and having the majority of the population with optimal immunity to what's circulating is one way to protect those people.
And Dr. Moffatt, you're a pediatrician, so obviously you not only deal with your patient, you deal with parents every day, and most of them may be less concerned about COVID, for example, than they are about, RSV or the flu. So what do you want them to know?
I would want them to know that COVID is still with us, and it is very likely to be a major player in our more typical sort of fall to winter respiratory viral season moving forward, much like flu and much like RSV. And we have influenza vaccines, have had them for a long time now, that are very good at preventing severe infection. If we have safe and effective COVID vaccines that can do the same thing, that will go a long way towards keeping our hospitals and our healthcare infrastructure from being overwhelmed during what is typically a very stressful season.
Dr. Moffatt, always great to see you. Thank you so much.